दिया।
ठीक है कुणाल, मुझे बस बोल देना जब लाइव हो जाएगा ना।
ठीक है सर, जैसे वो YouTube पे ओपन होता है मैं आपको बताता हूँ।
ओके
ठीक है सर वी आर लाइव।
ओके जस्ट अ सेकंड प्लीज। Yeah, I'll open the chat box. Okay. Hello friends. Welcome to the MIQ session. Most important questions in PSM for NEET PG examination. And I am your very own Dr. Vivek Jain from Cerebellum Academy. So friends, first just confirm. Audio is fine there. Video is fine there. Dr. Kazi, Dr. Azizu, Dr. Shubham, Dr. Anurag, Dr. Sin, Dr. Kuldeep, all of you are welcome friends. Dr. Akshay, you are welcome. Kindly confirm in the chat box if audio, video is absolutely clear. Video should be clear. Audio should be clear. Even if I'm not visible, it is fine, friends. Dr. Sin, Jai Hind. Dr. Akshay, good evening. Dr. Kuldeep Dhanetia, good evening. Thank you, Dr. Kuldeep, for confirmation. Dr. AM is asking, is this helpful for FMG? Friends, definitely it is helpful for FMG because now National Board of Examination is the common examination body between the NEET PG and the FMG exams. And last 2-3 papers, if you see, there has been few questions from here to this paper to the other paper. So definitely sessions, yes, oriented towards NEET PG, but it is going to be a big revision for FMG students as well. Amardeep Dudi, Ram Ram Dost. Prashant Pilala, doctor, thank you for confirmation. Okay, friends, now before we start, few things I must tell you that kindly focus on your studies, only and only on your studies. Whatever is happening around you, do not focus on that. There will be too much disturbance, distraction in between. Don't look at that. Focus on your studies. This is the final time to deliver. FMG, we are just left with few days. NEET PG also, we are left with just few weeks, let us say. So target that, utilize it fully. We will keep on doing live sessions for your academic benefit for the examinations non-stop on this particular channel. So I'll request all of you to kindly quickly subscribe to the Cerebellum channel if you have not already done so. Kindly subscribe quickly, friends. Also press the bell icon so that whenever we go live or there is any other update, you won't miss it. Friends, I'll stay connected with you through the chat also, so that we can discuss way more than what we have planned for today. So I'm just waiting few more students to join us. Dr. Anand Ritesh, good evening. Dr. Ayushi, thank you. Dr. Haleen Baba. PSM is enough you do from any source, friend, be it Cerebellum, be it Prep Ladder, Marrow, Gurukul, Doc Tutorial, or even if you're doing studies on your own. Friends, it is how you put in your efforts. Subjects cannot be different, topics cannot be different. This you have to remember, right? So just give it your 100%. Dr. Gurdeep Saini sir, if I prepared from some other app, ये session के बाद सब mix तो नहीं हो जाएगा, कुछ mix नहीं होगा, दोस्त rather consolidate हो जाएगा. अगर उस ऐप में आपका कुछ मिसिंग था, I will plug the gaps and I'll make sure that you enter the exam with 100% confidence. Thank you, Dr. Bhavya Pratap. I am also a big fan of all my students. Okay, friends, so it's now time. Let us not waste time. Subscribe to the Cerebellum YouTube Academy channel, press the bell icon and let us start. Let us study together. MIQs, most important questions for PSM for upcoming NEET PG examination as well as FMG examination. And I am your very own Dr. Vivek Jain. So friends, what I'll do is whenever I'll share a question, I'll give you some time to answer because there is a lag of around 15 to 20 seconds between this live transmission and how you get it. But we will try to make it a two-way discussion. And let us see how much of us we can benefit from today's session. And these sessions will keep on coming. So get your balance right. Let us start. So on your screen now comes the first question. False regarding iron folic acid supplementation under Anemia Mukt Bharat program is. Friends, Anemia Mukt Bharat comes in every exam. Last 5 years I have been seeing, हर एग्जाम में से क्वेश्चन आ रहा है. तो आपको ध्यान से क्वेश्चन पढ़ना है. आप बस ध्यान से क्वेश्चन पढ़ो और उसके बाद मार्क द करेक्ट आंसर. क्वेश्चन को ध्यान से पढ़ना. Reading the question correctly is important. I will wait for your answer so that you get time in the exam. Consider in exam you get 1 minute to read, understand, mark the answer. We have started getting the answer. Alia Khan, Arun Kumar, first answer came from Alpha Summers. He says it is D. Maggie says D. Nilesh Somen, Dr. Bhavya, Dr. Yash, Dr. Dhankil, Dr. Gurdeep. Everyone is saying D. So D ko lock kar de dost. Okay. Friends, let us try to understand a matrix which is going to be very beneficial for you in this Anemia Mukt Bharat program. I will come back to the question again. So, what is the logo of Anemia Mukt Bharat looking like? कैसा देखने में लगता है? How is the logo of Anemia Mukt Bharat? It is like this. And what is the commonest question asked from Anemia Mukt Bharat program? Always they ask you target beneficiaries and their iron folic acid supplementation. There are a total of 6 target beneficiaries. Let us look at them. These are 6 to 59-month-old child, 5 to 9-year child, 10 to 19-year adolescent, 20 to 49-year non-pregnant, non-lactating women. Friends, please remember, reproductive age group is even today 15 to 49 years. It has not changed. But because in this program, 10 to 19 is covering 15 to 19. So only for Anemia Mukt Bharat, they are calling reproductive age as 20 to 49. But in reality, except this program, it is 15 to 49 years. Then we have pregnant females and lactating women. Now, when we look at their iron and folic acid supplementation. So friends, you know, iron is in milligram. Folic acid always is in microgram. So how much a child below 5 years need? 20 milligram elemental iron, 100 microgram of folic acid. 5 to 9-year-old child. This was a question recently asked. It is 45 milligram of elemental iron and 400 microgram of folic acid. And now it is easy to remember for all other groups. It is 60 milligram elemental iron and 500 microgram of folic acid. Now, all of you definitely know this is in the form of a syrup. Logically, child below 5 years. But when you look at 5 to 9-year-old child, this is a pink tablet. When you look at 10 to 19-year adolescents, adolescent blues, blue tablet, and all other groups have red colored tablet. So if they show you a color coding scheme, you should be able to mark it. Now, friend, this is the classical question which you always get. Iron folic acid supplementation. But let's do all related questions very quickly. What is the older name of Anemia Mukt Bharat program? It is NEEP, National Iron Plus Initiative. Okay, in between, Dr. Ruxana is asking, when are you going to take for FMG? Friend, this session is meant for NEET PG, but also benefiting FMG exams because both are having a common board of exam. Even paper pattern is nowadays same. National Board of Examination. I will conduct a separate FMG session. I will conduct more sessions for NEET PG FMG also. Try to use as much as possible in this. So National Iron Plus Initiative of India is now known as Anemia Mukt Bharat. And if I ask you a question, what is the main aim or goal of National Iron Plus Initiative? Please remember this, is to reduce prevalence of anemia by 3% every year. And this is from which period to which period? This is for 5 years, 2018 to current year 2022. So reduce 3% anemia prevalence points every year. Now, friends, what is the strategy used in this program? That is known as 6x6x6 strategy. So if someone asks you, what is 6 by 6 by 6 strategy? That is 6 beneficiaries, 6 interventions, and 6 institutional mechanisms. Beneficiaries, interventions, institutional mechanisms. In interventions, iron folic acid is asked. Also asked is, this program is coupled with deworming program, albendazole. That deworming is carried out biannually. So please remember, for all the groups, deworming is carrying out biannually. Pregnant female, it is carrying out once, only in the second trimester. So this you have to remember. So friends, if you have memorized this, this is the minimum to maximum you have to understand, then answer this question. We come back to this question. All of you have marked it correctly. Dr. Alia Khan has responded correctly. I'm looking at the screen to check your comments in the chat section. Dr. Alpha Summers is right. INEP. Dr. Qazi Saifuddin is absolutely right. Alia Khan is right. February, August, we do National Deworming Program of India on the 10th of February, 10th of August. So very right answer to this question. If you look choice wise, try to exclude the other choices. First choice is correct, 20 and 100. Second choice is correct, 45 and 400. Third choice, adolescent, is also correct. Only difference is in the color of the tablet between children and adolescents and between adolescents and other groups. So answer to this question is choice number D. Because for pregnant females, lactating females, reproductive age group females, as well as adolescents, it's not 100 milligram. It is 60 milligram iron, 500 microgram of folic acid. So friends, most of you have answered this correctly. I'm happy. As I move to the next question, can you answer this iron folic acid supplementation is which level of prevention? If you look at disease prevention, is it primordial? Is it primary? Is it secondary? Or is it tertiary? So just think and answer. Is it primordial, primary, secondary, or tertiary? Okay, I'm waiting for your answer. Dr. Qazi says secondary. Dr. Afreen says primary. Dr. Smriti Shri says, okay, friends, we are getting different answers. Many of you are saying primary, many are saying secondary. Please remember, this IFA supplementation is given to everyone, irrespective of the hemoglobin status. So it is primary level specific protection. We are trying to prevent the occurrence of disease. And why we are giving to everyone? Because risk of anemia is very high in the country. It is not secondary because it is not meant for treatment. For treatment, you will have to double or triple the dose, or maybe you have to use injectable iron. So if you double this dose, triple this dose, or use injectable iron, or even blood transfusion in severe anemia, then it will become secondary. So please remember, National Iron Plus Initiative, Anemia Mukt Bharat, mainly operates at primary level of prevention. So we'll clear this concept in another question, which will come later also. Let's move further. Question number 2. Read the question carefully. At a primary health center, you are given 1 vial of pentavalent, 1 vial of MR vaccine, 2 vials of COVID vaccine. All were already open from before. Provided that all the cold chain requirements are still intact, will you use them or discard? Mark accordingly. So friends, I am waiting for your answer. Will you use all, will you discard all, or will you use some and discard? First answer we get from MS says C, Alia Khan says, Dr. Alia Khan says C, Dr. Alpha Summers says C, Dr. Anurag Sharma says C, use pentavalent, discard MR. So friends, most of you are going in the right direction. This is based on the concept of, yes, open vial policy. Now, what is open vial policy? Generally, you get a question that it is applicable on which vaccines, it is not applicable on this vaccines. I'll come back to the question again, but just to tell you open vial policy, up till what time, if vaccine, despite being opened repeatedly, but if it is maintained in correct temperature, that is cold chain during transportation and during usage, during the session, up till what time you can reuse the vaccine by taking it out again from the cold chain and maintaining it in cold chain even during the session. That time period is within how much time? Dr. Afreen has answered this fastest. It is 28 days. Now let us see what is asked from us in the exam. for which vaccines it is applicable. Friends, please remember, open vial policy is applicable on first T series of vaccine, T for tetanus. So which vaccines are included in T series? DPT. Obviously, it will include TD. Then it includes tetanus toxoid, hepatitis B. So these vaccines are included in the T series of vaccines. Also, it is applicable on OPV, IPV. Now, just to confuse you, or rather just to strengthen or consolidate your concept, OPV, IPV, which of them is Sabin vaccine? You think over it. Sabin vaccine is OPV or IPV? Right, Sabin is oral polio vaccine, SAC is IPV. Then it is also included on or applicable on pentavalent vaccine. Please remember, pentavalent vaccine in the national immunization schedule, a question has been asked, includes 5 vaccines: diphtheria, pertussis, tetanus. It also includes hepatitis B and Haemophilus influenza B. So you have to answer all vaccine questions according to the national immunization schedule of India. Then it also includes the new pneumococcal conjugate vaccine. Okay, I'm reading your answers. All of you are marking correctly, but it is better to remember and read all the vaccines. Now let us see for which vaccines it is not applicable. So it is not applicable for which vaccines? Mainly it includes lyophilized vaccines like BCG, where normal saline is the reconstituting diluent. Then measles, MR, MMR. So measles, MR, MMR, that is also, it is not applicable. Then also it is not applicable on Japanese encephalitis vaccine. It is also not applicable on rotavirus vaccine. Now, what about COVID vaccines? Covaxin, Covishield, and which is the third vaccine which is currently available and used in India? I'm not talking of approval, available and used. Covaxin, Covishield, and third is Corbevax. That is for 12 to 14 year of children or adolescents, you can say. So COVID vaccines, is this open vial policy applicable or not applicable? I'm waiting for your answer. Dr. Alia Khan responds fastest, yes, it is not applicable. So COVID vaccines will definitely come in the choices this time. Please remember, open vial policy is not applicable. Now, friends, let me tell you a very interesting thing. I'm sure not all of you must have been or would be aware about this parameter. Now, there is a difference in the location of VVM. Vaccine vial monitor is a sticker, you know, right? So what is the location of VVM on vaccines on which open vial policy is applicable? What is the location of VVM on the vaccine vial where open vial policy is not applicable? आप जरा सोचो, इसको अगर आप logically भी सोचोगे ना, even if you think logically, you will get the right answer. So friends, just tell me, applicable, where exactly it is applicable? These vaccines. So where will you find VVM? VVM will be found on label. So wherever the label of the vaccine is there, you will find VVM is on that label only. Whereas VVM is not on label but elsewhere. On vaccines where it is not applicable, like on the cap. Because the moment you want to give a vaccine to a child from a vial, logically you'll have to take off its cap, you'll have to break the cap, right? So, or it will be on the neck, for where you have to break the neck or the cap, so that it is automatically understood. Now you're destroying the VVM. This vaccine will not be usable again, right? So this you have to remember logically. It is mentioned in the Government of India document also. Now again, one more thing. Suppose a vaccine says expiry date. So what that expiry date is related to? That is related to the date till the vaccine vial is opened or can be used. After that, it is usable up till 18 days. Right, friends? So let us move forward. I'll repeat. Open vial policy, if applicable, VVM will be on the label on the vaccine vial. If open vial policy is not applicable on vaccines like BCG, measles, then VVM will not be located on label. Rather, it will be elsewhere on the vial like cap or neck. Let us move forward. So what is the answer to this question? Absolutely right. Use pentavalent and discard these two. So answer to this question is C. Right? So friends, concentrate, C for concentrate in this answer. Just remember the vaccine for which it is available or applicable, for which open vial policy is not applicable. Right? So it tells you reusability of vaccine, even if some doses are left and the vaccine has been properly maintained in cold chain so far. Right. VVM, Dr. Shubhashish is asking, VVM is vaccine vial monitor. Vaccine vial monitor, you must have seen, it has a circle outside and a square inside, and circle always is blue in color. This is grade 1. If vaccine is not maintained in proper temperature, grade 2, inner square starts changing color, it becomes light blue. In grade 3, it becomes exactly blue. And in grade 4, it may become purple, dark, or even black. Based on WHO grading of VVM, grade 1 and 2 are usable. Grade 3 and 4 should be discarded. It's a very popular question. Vaccine vial monitor. Let's move further. Next question. See, COVID biomedical waste management guidelines in India have been given by Central Pollution Control Board. So they released 1, 2, 3, 4, 5, almost same in all the versions, but now the latest version, that is guidelines with an amendment version 5. According to them, all of the following COVID biomedical waste must be disposed of in yellow bin except. So mark this answer. Let me check. What are you responding to this question? Okay, we have started getting the answers. Dr. Arun Kumar says C. Dr. Alia says A. Dr. Subhash says B. Dr. Agnimita says D. Friends, all the 4 first answers are saying different choices. How it is possible? COVID biomedical waste management guidelines, we cannot go wrong at any chance. There is no chance at all. Okay, friends, that means let me discuss this properly. So first we look at, there are 2 major things, biomedical waste, even for COVID-19, yellow bag, red bag. So what will go in yellow bag? The yellow bag will include the N95 mask that we have used so much, the triple layer mask, 3-layer surgical mask, which we call as, I am writing so that you can write down, or maybe you can take a screenshot if you have facility available. Also, it includes head cover. You can say head cover is same as cap. Shoe cover, that goes into yellow again. Also goes linen gown. Also, it includes any used mask, tissue, toiletry of patient. Also, it will include any type of swab which has been taken for diagnosis. So all this will go into yellow color coded bags. Friends, you cannot do wrong in this because many of us are giving wrong answers. Red bag will include, this will include PPE. So your PPE kit will come into that. It will also include goggles, face shield. It will also include your hazmat suit or suit. It will also include your nitrile gloves. Also, it will include thing that students miss while revising in the exam. I'm telling you, rapid antigen test kits. So after the kits have been utilized, they will go into this. Also, if there are any cartridges or tubes of CB NAT test that we also use in tuberculosis, and also if there are syringes. Rule will remain same. If any blood residue, then the syringe will go into yellow. So otherwise, this is the basic that you have to mark correctly. So friends, I am happy many of you mark this answer correctly. Those who have not marked correctly, nothing to get disheartened about. Let's understand this. Let's remember this. Please remember, in exam, you have to mark it correctly. So answer to this question is choice number C. Hazmat suit will go into red bag. N95 used tissue of patient shoe cover will go into yellow bag. Now, friends, two more things, or rather 2-3 more things I should tell you about COVID biomedical waste management, because this has a high probability of being asked in this NEET PG and upcoming FMG examination. So first thing is this biomedical waste management guidelines for COVID. We have to use double bags, or you can say double layered bags. Generally, we don't use double layered bags, but here we use. Any bin or trolley you are using for carrying this waste, that bin or trolley must be disinfected with 1% sodium hypochlorite, the universal disinfectant, we can say. Also, if there is some biomedical waste like mask, gloves are generated at homes of patients, then before disposing them as biomedical waste, they should be kept at home for 72 hours. Maybe in a paper bag, they should be kept at 72 hours as a waiting time for mask, gloves, which are generated at household or home level. So friends, go through this, take a screenshot right now. I'll pause for 5 seconds. So take a screenshot so that you remember this. Otherwise, these guidelines are available everywhere on all platforms, right? Absolutely. So friends, let's move further. Easiest question. What is the shelf life of IUD contraceptives? Which of them is incorrect match? I'm waiting for your answer. It says Progestasert shelf life is 1 year. Okay. Copper T 388, 10 years. Copper T 375, 8 years. 4 choices, none of the above. It says all are correct. So what is your answer? Which is the incorrect match? Let me wait for your answer. Let us see how many of us can answer this correctly. Okay, we have started getting answers. Dr. Manish says A, Dr. Pulkit says C, sorry, I'm not able to read all the names, but दोस्त समझो कि मैं आप सबके नाम पढ़ पा रहा हूँ. Dr. Oishi C, Dr. Mercy C, Dr. Prashant Pilala C, Dr. Dimpy Roy C, Dr. Qazi Saifuddin says 10 years. Okay, Dr. Mayur says C, Dr. Vinay Yadav says A. तो दोस्तों अलग अलग आंसर आ रहे हैं, देख लेते हैं इसमें से कौन सा है. इसको एक्सक्लूजन से करते हैं. प्रोजेस्टासर्ट की शेल्फ लाइफ 1 to 1.5 years ही होती है. So that is correct. Which is the IUD with highest shelf life? That is Copper T 380A, 10 years. That is also correct. In our RCH program of India, 2 IUDs are recommended. One is Copper T 380A, and the second IUD, which was introduced in 2012, 10 years ago, that is Copper T 375. So you will be asked question about Copper T 375 this upcoming exam. So what is the shelf life of Copper T 375? That is actually not 8 years, but 5 years. So C for cap, C for cover becomes the answer for this particular question. C for concentration becomes the answer. So friends, please remember, it is 5 years for Copper T 375. We cannot go wrong in these type of questions. Okay, friends, now just to tell you so that you have a good visual memory. On the screen, 2 types of IUDs are there. Can you identify if there is an image-based question? Because contraceptives, a lot of questions come image-based. So which IUD is first one? Let's give them number A and alphabet B. So which IUD is which one? I'm waiting for your answer looking at the screen. Which is, yes, it is definitely helpful for FMG, friends. Questions are clinical in FMGs also. In fact, in last 6 papers of FMG, 3 FMG papers, I should say, I must tell you, were more difficult than the NEET PG exam. You have to be careful. NEET PG becomes difficult due to more competition, but FMG papers are becoming slightly difficult, slightly trickier. Okay, we have started getting the answer. First is Copper T 380A. Dr. Ayushi Dwivedi says. Dr. Alpha Summers says. Dr. Maggie also says. What about B? B for Bombay, which is that IUD. Most of us are correct. It is multi-load 375. So friends, you are right. This is Copper T 380A. This is Copper T 375. Now, a usual question. What is 380? What is 375? What is the number in this? This is surface area of copper. Mind you, not surface area of copper T total, only copper in millimeter square. So here it is 380 millimeter square. Here roughly it is 375 millimeter square. Now friends, let me tell you a totally different thing altogether. IUDs have got tails, what we call as strings, right? It is the color of strings which is different for these two type of IUDs. In Copper T 380A, the strings. Okay, let me draw so that it becomes easy for you. Copper T 380A, the string, suppose it is here, although it must be here somewhere, here. Strings are white in color. Whereas in Copper T 375, another identification feature is they are green in color. Right, so please remember. Also, I must tell you one more thing. Copper T 380A is one of the most cost-effective contraceptives in the RCS program of India. Because 10 years, single time you insert IUD, it is effective for total 10 years. There is no need to take it before the completion of date of 10th year also. So please remember that. Also, Copper T 380A is the most commonly used IUD in the world. A very old question of UPSC CMS, because India has highest IUD users in the world. So Copper T 380A, most common in India, most common in world also. Copper T 380A, effectivity is for 12 years. Please remember, effectivity is 12 years, but in the program, for implementation purposes, we consider it as 10 years. So this is something that we have to remember. So I hope we'll not forget and do any mistake in this now. Let's move further. So many questions you must have seen for cervical cancer vaccines. Read it and mark the incorrect match. दोस्तों क्वेश्चन को भी ध्यान से पढ़ना बड़ा जरूरी है. Incorrect match. I have tried to combine 4 questions into a single question so that you can mark correctly. So I'm waiting for your answer. First answer comes from, okay, from the IUD questions, Dr. Soumyaranjan has asked A means arm. Yes, majority of books say arm. Very few books mention A means AG or AU, silver or gold, that is additionally present in Copper T 380A. Majority of gyneops books say A means arm. Okay, answer we are getting for this question is B for Bombay. Dr. Mayur says D. Okay, most of you are answering B or D. Why? I am asking incorrect match, dear. MS says A. Dr. Avantika says A. Dr. Subhashish. Friends, that means you are not reading the question carefully. These are questions which are going to come in the upcoming NEET PG exam as well as FMG exam. I'll do separate session for FMG also. There will be a mega session also around 2 to 2.5 weeks before the actual exam because students requested for that time. Similarly, I'll have a big mega session before the NEET PG exam also around 2-3 weeks prior to that. But please do not miss out on these sessions. These are very, very productive high-yield sessions. Friends, HPV, human papilloma virus, which is the most common subtype responsible? It is HPV 16-18 in India. Which is the second most common type? 6-11. Which is the third most common type? 31-33, then so on. So many types of HPV virus subtypes are responsible. Now, out of this, if you are asked a single answer, 16-18, out of these two, which is the most common responsible for cervical cancer, it is 16. See, this is most common. This is second most common. This is third most common. Think logically. any vaccine which is made will have to include at least 16, 18 because these are most common. So when we look at Cervarix, Cervarix includes 16, 18. When we look at Gardasil, Cervarix is bivalent. Gardasil is quadrivalent. So it includes 16, 18, 6, 11. And when Gardasil 9 came, it will definitely include 16, 18, 6, 11, 31, 33. It also included 42, 50, 45, 52, and 58. So this is also correct. Now, Cervavac. Please remember, Cervavac is India's first 100% indigenous vaccine. We are talking of cervical cancer vaccine, indigenous. It has been launched by Serum Institute. They are saying definitely the cost per shot will come down to 100 to 200 rupees, which is way lesser than what is available commercially in the private sector with Cervarix, Gardasil. And because it is designed specifically for India, we have to include most common 16 to 18 and second most common 6 to 11. So even this is correct. So B, C, and D are correct. They are asking incorrect match. So answer to this question is A. Cervarix does not include 611. Rather, that includes 16, 18. So friends, many of us have gone wrong in this question. I was not expecting this, but let's take it as a lesson for us. Let's get our balance right again, like cerebellum. So friends, try to go through this topic again. I remember one question was there in INICET exam 1, that there are many proteins, but which are the actual proteins which are used from HPV to produce the vaccine? Can anyone answer this question? I'm waiting for your answer. I look at the screen and wait for your answer. Which proteins from human papilloma virus are used to produce the vaccines? Can anyone tell me? Which proteins? Dr. Alpha Summers has given first correct answer. Dr. Arun Kumar, you are also correct. So friends, very right. Mostly we use LNE. Out of that, L1, L2. Where L stands for late proteins. So L1 mainly is the single best answer. But L1 and L2, these are antigenic. They lead to production of antibodies. Late proteins L1, L2 are mainly used. E is also used, but L1, L2 are mainly used for production of vaccines. Now, please remember, out of all these, I'm trying to connect another question to this. If you look cervical cancer, most common subtypes are 16 and 18. This is for cervical cancer. But if you are asked for genital warts, then the most common subtype is 6 and 11. Therefore, cervical cancer vaccine actually should be given to boys also, because genital warts is there, right? So boys or girls, 9 to 26 years of age best, but ideally it should be given at onset of puberty. So girls 11 to 13 years, boys 12 to 14 years must get anti-HPV or cervical cancer vaccine. Can anyone tell me this is which level of prevention as I move to the next question? Which level of prevention is this? Come on, Dr. Deepu Patil, Dr. Subhash Bishnoi, Dr. Kritika Sharma, Dr. K. Monica, Dr. Soumya Ranjan. I'm waiting for the answer. Tell me, please, which level of prevention this represents. Okay, Dr. Smriti, she says secondary. Dr. Dikshant, roll number 37, Kumar says it is primary. Friends, vaccines are always primary level specific protection. You can remember it as a golden rule. All vaccines, majority of vaccines, all vaccines, including BCG, primary level specific protection, except BCG in bladder cancer, which is secondary level. So all vaccines will remain primary level specific protection. So let us not just discuss these questions, but let's see all the relevant questions also. तो इसके साथ जितने भी बाकी questions हैं वो भी discuss करते हुए चलते हैं. Let's move further. Okay. This is an interesting question. You are a medical officer of a PHC. There is an earthquake in your catchment area. As a manager, you will teach following measures to be observed by all persons in all types of emergencies except. This word you must always read in the question carefully. दोस्तों पूरा क्वेश्चन पढ़ लिया, समझ लिया, कॉन्सेप्ट याद कर लिया, लेकिन उसमें एक्सेप्ट जैसा वर्ड मिस कर दिया तो बड़ी गलती हो जाएगी. तो रीड द क्वेश्चन. लेट अस वेट फॉर योर आंसर. मैं पढ़ देता हूं इतने चॉइसेस जितने आप आंसर लिखोगे. लिसन टू द मैसेजेस ब्रॉडकास्ट बाय रेडियो एंड वेरियस मीडिया टू बी इन्फॉर्म्ड ऑफ डेवलपमेंट्स व्हिच आर टेकिंग प्लेस. Carry out the official instruction given over radio or by loudspeaker. Use the telephone to continuously monitor your relatives or friends' well-being. Keep a family emergency kit ready. Now, what we are there asking, all of them have to be done by every person in any type of emergency. Emergency means we are talking of disaster, earthquake, flood, tsunami, volcanic eruption, terrorist attack, like so on. Which of them should not be done? Oh, again, we are getting different answers. Dr. Dhanshil Jariwala says A, Dr. Akshi says C, Dr. Agnita says D, Dr. Madhurkar says B. Friend, this is one question where I'm getting all 4 different choices again. Disaster management, please understand. See, suppose, let us put ourselves in their situation. Let's say we are the general public. Okay, let me put I am in the general public. There is an earthquake in my area. So what will I do? Listen to the messages broadcast by radio and various media to be informed of development. Yes, I will definitely listen to the radio or TV if it is working. I want to know what is happening so that I don't get into panic mode and prevent my family from getting into panic mode. Look at choice B. Carry out the official instructions given over radio or by loudspeaker. Yes, definitely. If some instructions are given over radio that all of you should move to this part of your area, all of you should do this, all of you should get under the table, all of you should not do this, then definitely I will follow. This is also correct. Look at choice number C. Use the telephone to continuously monitor your relatives and friends' well-being. No. Friends, I will not do this. If I keep on using telephone to monitor my relatives and friends, it will keep the telephone line busy. How will a person who actually needs help will be able to reach out to anyone or authorities? So please remember, I am only allowed as a general public to use the telephone only in the case I need help. So if general public need help, they should use telephone. They should not jam the network. They should not keep the lines busy to monitor your relatives and friends' well-being. Please remember that. I know it is slightly outdated because nowadays we are using WhatsApp, we are using mobiles, but this question appeared in one of the recent examinations. Look at choice number D. Keep a family emergency kit ready. This is logical, definitely. Minor injuries, all general public can do first aid themselves, or there will be instructions on the radio or official instructions on loudspeaker they can follow. So answer to this question is C. High chance this question will come again. Just go through this question once. Let's move further. Social psychology, a topic which is asked in extensive detail. Sometimes only a single question comes. I'm taking a question which has been asked multiple times in exam. What is the correct match for type of learning? And you have to match it with the associated attribute. So learnings are cognitive, affective, psychomotor, and associated attribute, attitude, knowledge, skills. So I'm waiting for your answer. See, these matching questions take some time. Read the choices also carefully. वेट करते हैं, गलती नहीं करना दोस्तों बस. मीनवाइल जिन्होंने आंसर मार्क कर दिया है वो फटाफट सब्सक्राइब करो सेरिबेलम यूट्यूब चैनल पे, क्योंकि इस पे लाइव लगातार आप सेशंस आते रहेंगे. और सेरिबेलम के सारी नॉन फेसिस को तो आप जानते ही जो आपके सामने है. डॉक्टर गोविंद राय गर्ग फार्माकोलॉजी, डॉक्टर स्पर्श गुप्ता सर पैथोलॉजी, मैं आऊंगा आपके लिए PSM, डॉक्टर विवेक जैन, डॉक्टर जैनब वोरा मैम आएंगी रेडियोलॉजी के लिए. इसके अलावा आपके सामने आएंगे डॉक्टर प्रवीण त्रिपाठी सर, बेस्ट साइकेट्रिस्ट इन दी कंट्री करेंटली, डॉक्टर पूर्ण मेहरा सर ऑर्थोपेडिक्स, और बाकी भी जो एजुकेटर्स हमारे साथ जुड़ चुके हैं. धीरे धीरे करके वो भी आपके साथ जुड़ेंगे ताकि आप एग्जाम में बेस्ट कर सको. दोस्तों इसमें अलग अलग आंसर्स आ रहे हैं. मैक्सिमम स्टूडेंट्स आर सेइंग डी, लेकिन काफी स्टूडेंट्स बी फॉर बॉम्बे भी कह रहे हैं. ओके डी. ओके डॉक्टर सौम्या ने इनफैक्ट वाला निमोनिक भी बोल दिया जो मैं स्टूडेंट्स को पढ़ाता हूं. कैप कैस बना तो कुछ और भी सकते हैं, राइट? लेकिन आप ये याद रखिए कैप कैस दिस इज मोर देन सफिशिएंट. सो कॉग्निटिव इज नॉलेज. फिर उसके बाद आपका आता है एफेक्टिव, वो है एटीट्यूड्स, और आपका साइकोमोटर है स्किल्स. तो इसमें जो आपका आंसर, अब आपको चॉइसेस ध्यान से पढ़नी है, A2 B1 C3. यस, तो ज्यादातर दोस्तों का आंसर सही है. मोस्ट ऑफ यू आर करेक्ट. आई एम वेरी हैप्पी फॉर यू फ्रेंड्स. A2 B1 C3. कुछ भी करो यार, किसी भी प्लेटफॉर्म से पढ़ो, किसी भी बुक से पढ़ो, इस वक्त अपना सोर्स मत बदलना, रिवाइज करो यूट्यूब पे आके सेशंस, लेकिन जो आपका ओरिजिनल सोर्स है, अगर आपका ओरिजिनल सोर्स मैरो है, प्रेप लैडर है, आपका ओरिजिनल सोर्स सेल्फ स्टडी है, डॉक ट्यूटोरियल है, ई गुरुकुल है, आपका ओरिजिनल सोर्स लाइव क्लासेस आपने कहीं पे अटेंड किए हैं, उनके नोट्स हैं, प्लीज 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 डू नॉट चेंज दी सोर्स, वो डिजास्टर्स हो सकते हैं। आप उन्हीं से अपना कंटिन्यू करते रहें, डेली क्वेश्चन प्रैक्टिस करें, क्योंकि एग्जाम अब बिल्कुल पास में आ गया है, और लास्ट 3 to 5 ईयर्स, मिनिमम 3 ईयर्स के PYQs करना जरूरी है। आज के सेशन के ज्यादातर क्वेश्चन भी PYQ पे ही बेस्ड है, राइट? तो कैप्चर्स याद रखना है। डॉक्टर अजीत पूछ रहे हैं, इज दिस वीडियो विल बी अवेलेबल लेटर सर? यस दोस्त, नॉलेज को हम कहाँ लेके जाएंगे? नॉलेज तो हमारी कॉग्निशन से अटैच है, राइट? तो नॉलेज हमेशा रहनी चाहिए सोशल मीडिया पे, यूट्यूब वीडियो भी रहेगा, लेकिन अभी साथ के साथ अगर आप कर लोगे, आई फील इट विल हेल्प यू मेमोराइज बेटर, क्योंकि जो चीजें हम आगे के लिए छोड़ते जाते हैं वो काम नहीं आती। दिस आई हैव सीन फ्रॉम माय पर्सनल एक्सपीरियंस। ओके, डॉक्टर मोहम्मद ईशा, I'll stick to English. Yes, knowledge is meant to be shared only, so video will remain on the channel. You can watch it any number of times. Yes, let's move forward. Okay, which of the following measures are useful in prevention and control of letharism? This letharism, food adulteration disease, what is it? Toxin, all of you know, BOA, beta oxalyl aminoalanine. It comes from Lathyrus sativus khesri dal. When it is mixed in arhar dal, this toxin beta oxalyl aminoalanine leads to all the manifestations. निखिल सालुंके जी पूछ रहे हैं ऑनलाइन ऐप कब आएगी? When will online app come? Friends, we are online for you right now. Don't think about anything else. App will take time whenever it will come, but right now focus on your studies. It will come. We will stay connected to you no matter what. We will not let you suffer in the exam. We'll try to give you as much as possible from our side. Okay, how long these sessions will be for? Dr. Divya is asking. Dr. Divya, these sessions will continue right up till your exam day. Don't worry, we are there for you. Okay, most of the answers we are getting is B for Bombay. 1, 2, 3, 4, 5, 7. Okay. Dr. Bhavika Jain says B. Dr. Arun Kumar says B. Dr. Yakshi Patel. Friends, this is an older question only. I have just modified it a bit so that you are forced to read all the choices. Dr. Rudra also says B. Dr. Sindhu says C. Dr. Sindhu only is different. Dr. Magnolia is different. Dr. K. Monica is different. Dr. Lokesh, Dr. Uday is also saying C. They are also different. Friends, they are different, but they are correct also. See, banning the crop. Yes, it helps, right? So if you ban the crop, people will not be able to consume Lathyrus sativus. They will not develop letharism. Vitamin C has a very good role in prophylaxis. In fact, this is a very good question. Which vitamin can be used for prophylaxis of letharism? Vitamin C. Steeping method, parboiling method are also very useful. Friends, I am sure you know that if you look at steeping method, we just soak in hot water. Whereas in parboiling method, you have to soak in lime. Usually we do it overnight for 12 to 14 hours. After that, you should boil, then boil. So both of these also help a lot to get rid of the toxin, like we do parboiling of rice, similar thing. Education of the public. What will you educate? Do not consume Lathyrus sativus. But Lathyrus sativus is cheaper. That is mixed in the more expensive arhar dal. So if population is not comfortable by not eating, then you have to advise them, try to keep it below 1/4. Many books say below 30%, below 1/4 of your total consumption. So if someone can keep it below 25 to 30% of total consumption of the total, then definitely there is a chance of prevention. Keeping moisture content below 10%. Friends, this is generally used for aflatoxicosis. Aflatoxin, which is generated by which fungus? Aspergillus. So contamination of groundnuts occur. So we try to keep moisture content below 10% to control aflatoxicosis. And this is another question of your exam. 20% solution to separate adulterant. Which disease are we referring to? This we are referring to is ergotism. Please remember this 20% also. High chance of this question getting repeated this time. 20% salt solution. Now, when you use, what happens? The purple or the black ergot seeds, they float, whereas the grains, they settle. So please remember what is the organism in this ergotism, that is claviceps. In aflatoxicosis, it is Aspergillus. 6 and 7 are not related to letharism control in any way. So answer to this question is choice number C. 1, 2, 3, 4, and 5. See, these type of questions generally come in INI-CT exam. I am keeping it here. Question is not difficult. Dekho, I could have made difficult questions, but idea is not to impress you. But idea is to help you focus on the previous 3-year questions. These all questions are derivatives of previous 3 years. Only thing I've done, I've tried to combine them into a single question so that you are forced to read and understand. So please, friends, take benefit of that and do correct answer. Mark correct answer in the exam, right? So don't worry, we will be always there with you. Anything missed, you can ask me again. Okay, so let us move forward. Next question. I've combined again 3 or 4 different questions which have been asked from Subcenter in last 3 or 4 years. Which of the following is not true about a subcenter? 6 subcenters are covered under 1 PHC. Provides interface with community at grassroots level. I'm waiting for your answer. Type A subcenter has facility for delivery. Type B subcenter has a provision for 2 beds. So we are looking at answer to this question, which is not true. Okay, first answer, Alpha Summers has given C. C for concentration. Dr. Drake also says C. Dr. MS, Dr. Maggie, Dr. Yakshi Patel says C. Dr. Manishankar, Dr. Dikshant, Vaibhav, Dr. Avantika, Soumya, Dr. FMG, Dr. Sindhu Oshi. Dr. Nilesh says A. Everyone else is saying C. Dr. Nilesh, please check your answer again. Dr. Rohitash says A. Again, please check your answer. Dr. Radha Krishna says C. Dr. Shivani says C. Friends, answer to this question. Let us go in a systematic manner. You just keep on revising. I'll just keep on asking you all possible questions from subcenter in next 1 minute. Just keep on answering. One subcenter is for how much population in plains? It is 1 per 5,000. In hilly areas, it is 1 per 3,000. Who is the key health functionary at a subcenter? It is multi-purpose worker, male, female. Female multi-purpose worker, if not there, she can be replaced with auxiliary nurse midwife. There is no medical officer at subcenter. There may be a helper worker. Only difference in functions of male and female multi-purpose worker, older question. Peripheral blood smear slide for malaria has only to be made by male multi-purpose worker. Otherwise, they have similar functions in all the health programs. Okay. How subcenter is different from PHC, CHC medical college, and CHC and PHC, especially in terms of administrative control. This is under central government subcenter, whereas PHC, CHC are under state government. I mentioned this in my video also. It's given in my review of PSM book also. 14th edition is currently there. Despite that, this question was recently attempted wrong by majority of students. So I'll again repeat, subcenter under central government, PHC, CHC under state government. Please remember, subcenter type A has no delivery facility. Subcenter type B has delivery facility, and there is a provision for 2 beds at subcenter type B. But if deliveries go above 20 per month, then additional 2 beds, 2 plus 2, 4 beds should be there. So please make a provision of this in your mind that subcenters have 2 to 4 beds. Type B subcenter has 2 beds generally for deliveries. If deliveries go above 20 per month, then additional 2 beds, 2 plus 2, 4 beds total should be there, right? So let's now read the choices. 1 PHC is for 30,000 population in plains. 1 subcenter is for 5,000 population. So logically 1 PHC will cover 6 subcenters. So choice A is correct. Choice B provides interface with community as grassroots level. Yes, it is the first point of contact. Look at choice C. Type says subcenter as facility for delivery. No, I have told you it's not available. So this is the answer. Look at choice D. Type B subcenter has a provision for 2 beds. Yes. If deliveries are more than 20, make it 4 beds. 2 plus 2. Right. So this question has a high probability of being asked. We should definitely know. Maybe if you want to know more, subcenter covers 21 square kilometer area at a radial distance of 2.6 kilometers. right? So this we should know. And one subcenter is generally nowadays for 4 villages. So all this you need to know. Let's move to the next question. Okay, read this question carefully, friends. It's not difficult. It is easy. I'll read the question while you mark the answer. Yes, Dr. Monica, you are right. Subcenter is smaller in hierarchy. Even then it is managed by center. So it is in the opposite direction. Subcenter by center, higher centers PHC, CHC by state government. A couple comprising 27-year-old male, 25-year-old female goes to Suraksha Clinic for STD diagnosis. So I've covered another question that STD clinic is now known as Suraksha Clinic. Male is diagnosed as positive for syphilis and started on treatment. Couple is advised on prevention of transmission of syphilis from male to spouse. Syphilis diagnosis and advice on prevention of transmission constitute which level of prevention? I've started getting answer. First answer has come from FMG, Dr. FMG D, Dr. Nilesh D, Dr. Yakshi D, Dr. Abhi, Dr. Alpha Samaj, Dr. Kazi, Dr. Prakash, Dr. Drake, Dr. Subhash, Dr. Bhavika Jain, Dr. Vani Shehnawaz, Dr. Amit Dhole. Friends, I'm taking your name so that I feel connected to you, right? I'm seeing your names. I'm so happy that we are connected right now. Dr. Prashant, Dr. Maggie, everyone is saying D. Dr. Madhukar is saying C. Dr. FMG screening is saying primary level of prevention. Dr. Amit is saying D. Dr. Vani. Okay, friends, let's go systematically. All of us know there are 4 levels of prevention: primordial, primary, secondary, tertiary. Let me quickly in 30 seconds tell you the shortcut to this. Primordial is before risk factors. So it prevents emergence of risk factors. Primary, if risk factors are present, but disease has not yet started, you can still prevent the disease. Secondary, disease may have started. Now you can diagnose and treat. And tertiary, when disease is in progression or it is over in the body. So now let us look at what they are asking in the question. See, friends, whenever there is a lengthy question, many times students get lost in reading the question. Can I tell you a shortcut for lengthy questions if you're getting confused? Read the last line first. Last line says, syphilis diagnosis and advice constitute which level of prevention? That's it. I don't even have to read the other part of the question, but you should read. So read whole question, focus on the last line. They're saying diagnosis and advice constitute which level of prevention? Diagnosis is secondary. So diagnosis is secondary. What about advice? Advice is prevention from male to spouse. Male is having syphilis. Now we want to prevent transmission to spouse. So maybe we can advise barrier methods. Risk is present. We are trying to prevent transmission of disease. So this is primary level specific protection. Friends, so many of you have marked answer correctly to this. Answer to this question is choice number D. Yes, D is correct. Diagnosis and treatment comes under secondary. Risk factor present, prevention of disease. Health promotion, specific protection comes under primary level of prevention. So lovely. This question, most of you attempted correctly. I'm very happy. Okay, let's move further. Read the question. A trend of incidence of diarrheal disease in a district over a period of 15 years should be plotted on which of the following graphs? Now, I'm not giving you names of the graphs. I want you to identify the graph because image-based questions will definitely be there. Okay, let us wait for the answer. I'm waiting for your answers. Dr. Yashasvi, Dr. Asmita, Dr. Rahul, Vikas, Prajapat, please give your answers. Dr. Babita Goyal, Dr. Sujal Patel, welcome to the discussion. Dr. Mohit Gupta, Dr. Rudra. Okay, we have started getting the answer. Dr. Rudra says B, FMG, Dr. MS, Dr. Drake. Everyone is saying B. Everyone is saying B for Bombay. Are you sure every one of you is correct? Yes, friends, so many doctors can never be wrong. You have to be correct. Now, before we come back to this question, let us look at these 4 diagrams. Now, quickly, can you write in the chat box, what are these A, B, C, D? I am starting writing and you also revise with yourself. A is histogram. Why histogram? Bars are attached to each other. Technically speaking, statistically speaking, this is quantitative continuous data. Look at choice number B, B for Bombay. This is line chart. because frequency can increase or decrease. If frequency only increase, it will become ogive. So this is line chart. Look at choice number C. There is gap between the bars. So this is discontinuous qualitative data. This is bar chart. Okay, let me check how many of you are answering correctly. Dr. Soma Mandal is right. Dr. Somaya Mandal, is right. Dr. Richa Soni is right. Dr. Aarti Verma is right. Dr. Afreen Memon is also right. Dr. Prince Bansal is also right. What about choice number D, D for Delhi? No one of you is commenting on D for Delhi. I'm waiting for your answer. Dr. Rahul Sahu is right. Dr. Aarti Verma. D for Delhi, I'm waiting for the first answer. Dr. Rahul Sahu says it is a polygon. Is it a frequency polygon, friends? No, friends, many of us are missing this. None of you have answered this correctly. Choice number D is actually frequency curve. See, polygon always have straight lines. Here it is a curve. So it is a frequency curve. Dr. Yogit Ameta, you are absolutely right. Please remember, it is a frequency curve, not a polygon. Polygon is always joined top middle points of each bar in a histogram with a straight line. So it is a frequency curve. Please remember, curve and polygon are different. Frequency, polygon, straight lines. Curve is in the form of a free running hand curve. So answer this question now. Clue in this question, trend. So whenever we measure trend of anything, what is the answer? It is line chart. Line chart or line diagram is best to monitor trend of anything in the population, right? It could be incidence, mortality, it could be comparison between two different diseases, two different age groups, two different population or sexes also. Next question. On World Health Day, 4 to 8 persons are sitting in front of an audience, are discussing health topics. CEO director welcomes everyone, opens meeting, introduces speakers. He then introduces topic briefly and invites speakers to present their point of view. This is a type of. Okay, I'll give a break of 5 seconds to me. Meanwhile, you write the answer. I'm drinking water to prevent my throat from drying. This is which level of prevention? This is primary level. Risk is there. I'm continuously talking non-stop, speaking non-stop, right? So this is primary level specific protection. Okay, everyone is saying panel discussion, but many of our friends are saying it is workshop. This is surprising, friends. How can we mix panel discussion and workshop? Dr. Alia is saying it is a symposium. So there is definitely a confusion in the methods. Okay, let me tell you one by one. First, we start with focus group discussion. Question came in your exam. Focus group discussion is how many participants? This was the latest question. It is 6 to 12 persons who sit on a round table like this and discuss with each other. A diagram is made by the recorder also like this. This diagram is known as sociogram. So 6 to 12 people, suppose you are the medical officer, you sit with 10 antenatal females, tell them about benefit of exclusive breastfeeding. This is a focus group discussion. This is a discussion. They can ask question, you can answer. So there is no audience involved. Please remember. Now, symposium. Symposium is series of lectures on any health topic by experts in front of audience. In your medical college auditorium, we organize a symposium of TB. So different TB experts, epidemiologist, medicine guys, surgeon, radiologist will come and tell you about the different aspects. So question answering is possible at the end. So it is definitely a Socratic method. Workshop is something technical. It is to impart practical skills or training. I have to teach you inguinal hernia repair. I cannot just tell you theoretically. You need a dummy on which you can practice, or we need an actual patient where I practice or where I actually carry out the procedure and you observe it and then you can try it. So this is something to impart skills and training. Good surgeons, you must have seen, they hold the hands of the residents and then teach them. Rarity nowadays, but let's hope you get such a good surgeon when you join surgery, right? So answer to this question is panel discussion. Friends, there are so many clues in the question. See, 4 to 8 persons sitting in front of an audience and discussing a health topic. What is panel? In panel discussion, panel of what? This is a panel of experts. Only experts will sit and discuss in front of an audience. Audience can ask the questions at the end, right? So this is a panel discussion. This is not a symposium, because symposium there is no discussion. Epidemiologist come goes, medicine person come goes, surgeon come goes, radiologist come goes. So symposium there is no discussion among the speakers. So discussion word is there. How can we miss it? It is only and only a panel discussion. Okay, what is the difference between symposium and seminar? Symposium is for a restricted audience. Let's say your own medical college. This question has been asked for Dr. Rishiraj Ghata. Dr. Rishiraj, symposium is meant for a smaller audience like your medical college. But when we look at seminar conference, this is at a bigger level, university level. 10 colleges can take part. State level, 15 medical colleges can take part. National level, 100 medical colleges can take part. You can say seminar conference is like your festival of pulse aims. All colleges participate, right? But when you do any intra-college festival only for your college students, that will be more like a symposium. So symposium is for a smaller audience. Seminar conference is at a higher level slightly. Please remember, one of the best ways to remember this, right? Okay, let's move further. Again, I'm asking a theoretical question which was asked recently from National Board. In terms of diagram, which of the following population pyramid best depicts a developing country? A, B, C, or D? Developing country we are looking at. Okay, friends, let's move fast so that we can finish by 8:30, 90 minutes. I will discuss as much as possible PSM with you. Okay, we have started getting the answer. Dr. VSK says A. Dr. Kazi says B. Dr. Oishi says C. Dr. Subhash Vishnu is C. Dr. Nigar Ansari says B. How can we have different answers, friend? Population pyramid. Correct answer to this question has been given by around 40-50% of the students. This recent question answer is C. See, please remember, we are being asked developing country. So what is the population pyramid of a developing country? It is an upright triangle. Normal triangle is like this. ऐसे होता है ना, normal triangle like this, which has a broad base and a narrow top. You have to memorize these words. These are technical words. Upright triangle, broad base, narrow top is for developing country. Why we are saying like this? Why it is a broad base? More children. India's population 30% is below 15 years of age. 1/3 of the population is comprised of children in India. So definitely we will have broad base. Then as we go up the age group, population will keep on decreasing. We have only 8% geriatric in the country, right? Now it's not developed country will be exactly opposite. Developed country will be this. B. Why? Because it is spindle shaped. Look carefully. It is in the shape of a spindle, which is having bulge in middle. So you have to remember photographically the image, and I'll tell you theoretically. Upright triangle, broad base, narrow top, more children, developing country. Developed country, there are lesser children, lesser older people, more people are in economically productive age group, bulge in the middle. So that is spindle shaped, right? So this we should be able to mark correctly. D is also a developed country only, where slowly and slowly it will start becoming what you call as globular. It will cylindrical, it will become slowly and slowly. That is also for developed. A is generally not seen. A is generally not seen, right? You are right, Dr. Yakshi Patel, more earning people in developed country, right? Or people where more people are about to enter that economically productive age group like India. If we have 30% children in India, next 10 years, they will enter into the productive age group. What is this known as? Older question of INICT. This is known as demographic bonus. Demographic bonus. Let's move further. Okay, read carefully. I've taken the example of hand washing. Which of them will be the logical sequence? Will you evaluate, then generate awareness, interest, trial, adoption, or anyone else? I'm waiting for your answer. Think logically and answer. Okay, first answer we are getting is C. Dr. Kritika, Dr. Sujal Patel says C. Dr. Afreen says A. Dr. Subhash says D. Friends, I am getting different answers. I am getting a feeling you're not practicing the last 3 to 5 years PYQs. Please practice them. That is the base on which your upcoming examinations will come. Most of the students are saying C. Dr. Alpha Samarji is saying D. Dr. Meghavi Patel is saying A. Dr. Yakshi Patel is saying A. Friends, till now we have got only 3 correct answers out of the 100 I have scanned. Okay, friends, that means we have to understand this. Okay, now we have started getting the correct answer. See, suppose look at a person who is sitting in a remote tribal village of India or sitting in a city, but he is not aware about hand washing. So first thing is he should be aware. Okay, there is something known as hand washing. Then his interest will generate. How is this hand washing going to benefit me? How it will prevent fecal route of transmission? He will evaluate. He will come to you. You are medical officer of a PHC. He will ask you, sir, how will hand washing help me? You can tell him in simple words how hand washing can prevent transmission of fecal disease, typhoid, cholera. He will go back home and try it. And if he feels it is beneficial, he will adopt. So answer to this question is choice number A. Awareness, interest, evaluation, trial, adoption. Okay, let me do one thing. I think isko samajhne ke liye, the best example will be what I am writing on the screen. Cerebellum. You were sitting at your home, medical college, college library, and suddenly you came to know there is something known as cerebellum. You were aware. Then you saw the photographs of a group of teachers who always think of students. So your interest generated. Dr. Govind Rai Garg, Dr. Sparsh Gupta sir, Dr. Praveen, Dr. Apur, Dr. Zainab ma'am. So you can see. So interest generates. You evaluate. How you are evaluating? You are going through our live sessions, right? And you are doing a trial simultaneously. And logically, when we are going to launch our app, then you are going to adopt the app. Students who are appearing in the exam before the launch of our app, whenever it happens, I hope, I wish, I give you 100% blessings. You don't get to need the Cerebellum app. Go and join the branch of your choice in the college of your choice. Just keep on studying. Do not waste any time. Small breaks are fine in between, but keep on studying. But other students who are going to appear in the exam subsequently next year or after next year, definitely Cerebellum will be one of the products of choice. So awareness, interest, evaluation, trial, adoption. Yes, thank you, Dr. Afreen, always with you. You are saying we are always with you. In fact, Cerebellum is for the students by the teachers. Thank you so much, friends, for your support non-stop. Which agency promotes health awareness in India? This is again a question which we must know. What is the answer to this question? Okay, FMG 120 saying I'm studying PSM from prep ladder. Your lectures, will I be able to get 25 out of 30 correct? Friends, any platform you are studying from, be it mine or any other teacher, out of 30 PSM, you have to attempt 25 correctly because 15 to 17 will be very easy repeats. 10 will be slightly trickier. You'll have to apply concepts. 25, 24 to 25 out of 30 is minimum in FMG also, NEET PG also. Okay, we are getting different answers surprisingly. Dr. Subhash and Shreyas says C, Central Health Education Bureau. Dr. Muhammad Aisha says B, Indian Council of Medical Research. Okay, we are getting different answers. This is something different. So friends, most of you are confused between B and C. Okay, friends, what happens in our exam? Examiner has no logic, right? But we have logic. At many places, even in PSM, although it's more a fact-based subject, you can apply logic and it will work. Let us see how. I start with first CBHI, Central Bureau of Health Intelligence. It tells you health information or informatics. So all the intelligence-based information is available, which can be used for policy making and decision making. This agency was or came into existence in 1961, and it is under DGHS, Directorate General Health Services. Indian Council of Medical Research, the word is telling you, It is for biomedical research. This agency is under Ministry of Health and Family Welfare, and it came into existence. This is one of the oldest organizations, 1911. Central Health Education. See, word is there, health education. So Central Health Education Bureau. This actually came into existence in 1956. This is for health promotion and health awareness in the country. And also, I must tell you one more thing. This was recommended by Bhor Committee. Don't get bored. It was recommended by Bhor Committee. Maximum questions come from Bhor Committee. National Medical Library. Those who are residents of Delhi, they must have used it once. Even in my graduation, post-graduation, every Sunday I used to go to National Medical Library. PG, definitely you should go once you are preparing for PG. And once you entered PG, cholo, during preparation, leave National Medical Library. But once you enter PG, that is the time to learn. Definitely go to National Medical Library. Almost all my Sundays in second year of PG, MD, PSM, I used to go from Lady Harding to National Medical Library just to go through the relevant journals, articles. It is one of the biggest or the best things in the country. This is for health science professionals only, this library. 1966, again under DGHS. So this DGHS, even this CHEB is under DGHS. So answer to this question is choice number C, Central Health Education Bureau. Many of you mark correctly. Okay, Dr. Subhash is saying FMG करने के बाद कहाँ जाएंगे सर? FMG करने के बाद आपको दिल्ली आना है ताकि हम इकट्ठे पार्टी कर सके. NEET PG students also, once you clear the exam, you can travel to Delhi or you send me an invite. I will come to your city and we will have a party. I'm a frequent traveler. Party जरूर करेंगे. Your parents deserve the best result. After your parents will be the most happy teachers, right? So please remember, first your parents, then teachers, then comes your own individual happiness, right? So just do it. We'll have a party. Very right. Okay, let's move further. A person with history of 10 years working in shipyard. He developed breathlessness and cough. Which disease are we talking of? I'm waiting for your answer. Yes, Cerebellum Success Party. Cerebellum Success Party is not important. Student Success Party is important. You may belong to any platform. Party to de sakte ho mein. You can give us party, right? Okay. So friends, I'm waiting for the answer. Shipyard. One of the latest questions. It will be repeated this time in either NEET PG or FMG exam. Okay, asbestosis is the answer we are getting from Dr. Kazi, Dr. Afreen, Dr. Bhavika, Dr. Alia, Dr. Yakshi, but Dr. Alpha Summer says it is silicosis. We are getting stenosis also as the answer. Okay, friends. See, when we are talking of shipyard, even when we are talking of roofing or plumbing, what is used here is maximum asbestos. So answer is asbestosis. So shipyard, right? Then silicosis. This is generally seen in cement and glass industry workers. And there was a new question a few years ago in National Board exam that was bauxite miners. So bauxite miners also give you that. Sidrosis, iron foundries, iron industry. And what is tannum is tin. Beside this, you know, textile industry workers, textile, cotton, so bicinosis. Sugar mill industry workers, bagasse is generated, so bagasosis. Particle droplet diameter size. Which particle droplet, sorry, not droplet, I should use the word. Particle dust size diameter. What is that? It is 0.5 to 3 micron. And one question where maximum students go wrong. What happens, or which type of this, any pneumoconiosis, is which type of hazard? Physical hazard, chemical hazard, biological hazard, none of the above. Pneumoconiosis is physical, chemical, biological, none of the above. Which type of hazard? It is a chemical hazard. Snowstorm chest x-ray, mainly in silicosis. Silicosis is the most common pneumoconiosis, most common cause of death also. Right, let's move further. A person with visual acuity less than 3/16 right eye and perception of light in left eye. He is which type of visual impairment category. Low vision, economic, social, manifest. I am waiting for your answer while I write the mnemonic. LESMA. Very few mnemonics, but you have to remember. Low vision, economic blindness, social blindness, manifest blindness, absolute blindness. So let us go through it systematically. Low vision is less than 6/18 to 6/60. Economic blindness is less than 6/60 to 3/60. You cannot go wrong, they are in sequence. आप गलती कर ही नहीं सकते क्योंकि बिल्कुल सीक्वेंस में. Less than 3/60 to 1/60. Less than 1/60 to perception of light present, perception of light absent. What is the rule when you are measuring visual acuity? It is always in better eye, best possible correction. Now look at this question. A person is having less than 3/60 in right, perception of light in left. Which eye is better? Only look at better eye. Better eye is this, right eye, less than 3/60. So this is a case of, yes, social blindness. Social blindness is also known as walk vision. This is a very old question of AIMS paper. When AIMS paper was, they are not NICT. And economic blindness is walk vision. Something new which many of you may not be aware, let me tell you. Now these are given numbers also. Visual impairment category number 1, 2, 3, 4, 5. LESMA is the mnemonic you have to remember. Blindness, most common cause is cataract. Low vision, most common cause is cataract. Please remember, low vision also cataract. It is ocular morbidity where uncorrected refractive error is the most common cause. So you have to remember it is refractive error for only ocular morbidity, otherwise cataract is the biggest problem. Which of the following is incorrect about the program depicted through the logo? Program तो आपके सामने लिखा ही हुआ है नाम, National TB Elimination Program of India. So quickly tell me what is the answer. I'm waiting for your answer. I'm looking at the screen of my computer, which is side by side. Okay, Yakshi Patel says I've written work vision for both. I'll repeat. Work vision, WORK. Work vision is economic. Economy suffers because you're not able to work. Social blindness is walk. You cannot walk also. Okay, we are getting answer D, but some are saying A, C. We are getting different answers, A, C, D. Most of you are answering D, let's say. National TB Elimination Program was launched on 1st January 2020. And then COVID came. But this program, what was the major goal? It is to eliminate TB. Earlier, the target year was 2030, but this program, we preponed it to 2025. So we preponed the target by 5 years for elimination of tuberculosis. And how we are going to do that? We have to reduce incidence by 80%. And we have to reduce mortality by 90%. Then there is a possibility we may eliminate TB by 2025. They're asking incorrect. So answer is D for Delhi. Eradication we cannot target at a country level by our own program. So please remember this correctly, friends. This is based on National Strategic Plan for TB Elimination of India 2017 to 25. So please remember, target year for elimination in our country is now 2025. Okay. Following is the correct regarding results of screening test used for cervical cancer. Yes, friends, please read the question carefully. They are asking correct or incorrect. You have to read the question carefully. Many of us are missing that. I think all of us know the concept. We know the facts also, values also, but we are not reading the question. Okay, this question says, let me make it more clear. Which of the following is correct? So we have started getting the answer D. Many of us are saying sensitivity and specificity are same. Dr. Akshay Naveen says C, sensitivity is less than specificity. Dr. VSK says, sir, this session will be enough for FMG. No, friend, academics are never enough. इफ एनी टीचर क्लेम्स कि मेरे इसी सेशन से सारे क्वेश्चन आएंगे तो गलत बोल रहा है, ऐसा नहीं होता। एग्जामिनर हो सकता है इसमें से एक भी क्वेश्चन आते, नॉट इवन अ सिंगल क्वेश्चन में कम फ्रॉम दिस सेशन, बट आइडिया इज टू प्रिपेयर योरसेल्फ। इफ यू सी केयरफुली, आई हैव पिक्ड वन क्वेश्चन फ्रॉम ईच टॉपिक and I am trying to cover as many questions as possible in a single topic. So friends, let's do one thing quickly. Let's first calculate. Here is the table. How much is the sensitivity? Sensitivity is A. I'm just doing it fast because in exam you just need mental calculations in 1 minute. A upon A plus C. See, this is your A, B, C, D. I can say this is true positive, this is true negative, false positive, false negative. So whatever formula you have learned, A upon A plus C, true positive upon true positive plus false negative into 100. 80% is the sensitivity. Specificity is D upon B plus D. 950 plus 50,000 into 100. 95%. So remember these two values, right? Sensitivity of this test is, we have seen, 80%. Specificity is 95%. You have to mark correct statement. So reading the question is also equally important, friends. You know the concept. I know you know the formula also. But these are simple calculations. You don't even need pen and paper. Mentally, you have to do 20 upon 25, 80%. So answer to this question is choice number C. There are total 20 to 25 formulae in PSM. In subsequent sessions also, well, and again conduct sessions for FMG, again conduct sessions for NEET PG. Again, I will go through these formulas so that you remember. Another question. I don't know why majority of students are marking wrong answer to this question. It has been given categorically in the textbook of PSM. I've mentioned this categorically in my videos also. I mentioned this categorically in my review book of PSM also. PARC also it is given. Most cost-effective test for screening of cervical cancer in India. Let's see how many of us mark correct answer to this. Okay, we are saying Dr. Yakshi Patel is giving an answer B. Dr. Subhash, Dr. Rudra, Dr. Manish Shankar is saying C, punch biopsy. Via test B and C, no, you have to mark a single answer. Most means single answer. You cannot mark two answers. Dr. Avantika Agarwal says pap smear. Dr. Megha Lalwani says pap smear. Friends, this is the confusion I was telling you. See, friends, pap smear is a very good test, but look at the word cost effective. And we are talking of India. What is the screening test of choice in India? That is the answer, via test. It is more cost effective. It is mentioned in the book categorically. This is the reason National Cancer Control Program of India has adopted it. Please remember, visual inspection of cervix with 5% acetic acid is the definitely most cost effective test for screening of cervical cancer in India. Friends, please do not do this or do not attempt this question wrong. It may come in one of your forthcoming examinations. This has to be marked correctly. Via test is most or the best test. In fact, when I look at via test, sensitivity and specificity, you will be happy to know that sensitivity of this test is very, very high, 89%. And specificity is also very good, 87%. In contrast, pap smear, the problem is sensitivity is very low, 55%. The good thing is its specificity is very, very high, that is 95%. But which is the most useful property of screening test? Usefulness of screening test is given by sensitivity. So look at sensitivity. Then via test is cost effective also. How it is cost effective? It is such a simple test. We don't even need a qualified doctor. We need only a trained health worker. It can be done. It is done at primary health center. If required, it can be done at a subcenter also. Please remember, punch biopsy is the diagnostic test. We are not talking of diagnosis. Examiner has categorically mentioned screening. So friends, please mark this question correctly. I'm telling you again and again. Any doubt, read my review book or go to PARC. It is mentioned there. Via test has replaced pap smear as the screening test of choice in India only because of this reason of easy to conduct, cost effectivity, developing country. If they ask you combination, then as one of our friends mentioned correctly, pap smear is also done, via test is also done. So via has replaced pap smear at all the lower levels, slowly and slowly, subcenter, PHC, CHC, it is replacing. because it is a better test, most cost-effective test. So friends, we are coming to the end of this session, but PSM, I want to teach you more. I will not let you go for another 5 to 10 minutes. Let us have rapid fire questions. 10 rapid fire questions. It will be one-liners. So take a deep breath, take oxygen, take water. I'm sure no one of you is having alcohol in your hand. That is not good. So take water, take deep breath. Now let us start. Okay, friends. So rapid fire questions. You tell me answer to this first question. What is NIV 2020770? I'm asking question in a opposite direction so that you are forced to think. Many times we just keep on reading question answer and we think we know everything. Let me ask you. Okay, Dr. Yashasvi Swami, you will answer first. Dr. Mohammed Isha, answer. Everyone is laughing on my alcohol comment. Alcohol लेना exam के बाद, not before or during the exam. During the exam तो वैसे ही possible नहीं होगा, right? Okay. Dr. Subhash says it is related to Covishield. Dr. Vaibhav says Covaxin. Okay, friends, many of you are going in the right direction, but many of you are marking wrong answer. Thankfully, many of you are correct. Dr. Kazi is correct, Dr. Vaibhav, Dr. Ankur Saini, Dr. Mahmudul Hassan, Dr. Rudra, Dr. Shashin. Every one of you is right. This is a strain of Covaxin. Let me quickly tell you next 30 seconds. 10 important questions from Covaxin. Covaxin is BB152. Its strain is NIV 2020770. It is India's first 100% indigenous COVID vaccine manufactured by Bharat BioNTech. It is 100% virion inactivated vaccine. So safety profile is very good. It has an efficacy of close to 78 to 80%. And it is currently recommended in India for age 15 years and above. Corbevax, which is a receptor binding domain vaccine, RBD, receptor binding domain, Corbevax, that is recommended for 12 to 14 years. Covishield, the vaccine which is a non-replicating viral vector-based vaccine that has no strain also, that Covishield vaccine produced by Serum Institute is recommended for age 18 years and above in the country. So I'm sure you must have taken the precautionary dose also. So let's move forward. Most common complication of mumps. Mark the answer. I'm telling you before that if you don't read the question carefully, many of you are going to answer this answer or this question wrongly. Please be correct. Make me wrong, but be correct. Most common complication of mumps. Then I'll give you so many important things about measles and mumps. Where is the answer? Okay, Dr. Qazi Saifuddin has given first answer, aseptic meningitis. Is this correct, friends? Dr. Mahmudul Hassan says CSOM. Dr. Dhanvil says orchitis. Dr. Afreen Memon says orchitis and parotitis. Okay, majority of us are saying orchitis, parotitis. Friends, first of all, parotitis is not a complication, it is a presentation. Therefore, virus, causative organism, mix of virus, parotitis. It causes inflammation, right? Parotid glands. Friends, most of you are wrong. I warned you. Please read the question carefully. Aseptic meningitis is the correct answer. Let me tell you again how you are not going to attempt this question wrongly in the exam. Mumps is a disease of children mainly seen in 5 to 9 years of age. In children, majority of cases are seen. In children, aseptic meningitis is the most common complication. But when we look at adolescents, then the commonest complication is orchitis in males, oophorytis in females. But this is a disease which is commonest in children 5 to 9 years. So overall, when you look mumps, it is aseptic meningitis. Even when you look at adults after adolescence, then it is meningoencephalomyelitis. So I'll again repeat, children in mumps, aseptic meningitis, adolescent in mumps, then orchitis in males, oophorytis in females. Orchitis is more common than oophorytis. Adults, meningoencephalomyelitis. But overall, it is maximum seen in children 5 to 9 years. So answer is aseptic meningitis. Measles, most common complication is, yes, serous otitis media. Adolescent age group, I've already discussed today. Now we cannot go wrong. First question I discussed, I remember that. That was in Anemia Mukt Bharat. What is the age group of adolescent? Tell me quickly. Meanwhile, I'll write the other question. Scatter diagram depicts which statistical parameter? We cannot go wrong in these two questions, friends. Okay, Dr. Qazi Saifuddin yet again gives first answer and absolutely correct. Dr. Subhash Bishnoy, Dr. Bhavika Jain is correct. Dr. Alpha Summers, Dr. Umar Khan, everyone is correct. 10 to 19 years. Okay, since many of you have mentioned, I go back to the previous question. Measles, most common complication is serous otitis media, but most common complication which leads to death, that is very right, pneumonia, and that is due to secondary bacterial infections, you have to remember. Okay, and then scatter diagram depicts. So adolescent is 10 to 19. You have to remember this. For adolescents, we have a program also, Rashtriya Kishore Swasthya Karyakram, RKSK. When you go back, go through it 7 C's. Next session of NEET PG or FMG session, I'll ask you what are 7 C's of Rashtriya Kishore Swasthya Karyakram. Okay, friends, so scatter diagram. Relation, associate, no. Association, relation, you cannot use in same words, Dr. Weber, because these are two different concepts. I've discussed in my video also. Okay, Dr. Yashasvi says relation. Okay, Dr. MS says correlation. This is better rather than relation. Let's use the word correlation. Correlation, relationship between two variables. Are you boyfriend, girlfriend sitting together and going through this video? This is a relationship, correlation, right? So this is correlation, relationship between two quantitative variables. Correlation coefficient R lies between -1 to +1. Positive correlation, 0 to +1. Negative correlation, -1 to 0. Absent correlation, 0. This you have to remember, right? Okay. When you use the word relation, that is also fine, but correlation means co. Two different variables are related to each other, like height and weight. If your height increase, weight should increase, right? Okay. HDI includes knowledge, income, and dash. HDI includes knowledge, income, and dash. लव की बात आते ही सब एकदम से खुश हो गए हैं, सबको अपना अपना कोई याद आ गया, मुझे भी याद आ गया, नेक्स्ट रूम में बैठी हुई है मैडम, राइट? ओके, होप के सारे जिंदा हैं दोस्त, कॉलेज में ऐसे ही होता है। और ज्यादा जानना चाहते हो जब आपके एग्जाम हो जाएगा ना, तो मेरा वो देखना है एमबीबीएस के किस्से सीरीज, और मजा आएगा। ओके, एचडीआई इंक्लूड्स नॉलेज, इनकम एंड डैश। वीडियो यूट्यूब से डिलीट नहीं होगा दोस्त, वीडियो इज मेंट फॉर ओनली स्प्रेडिंग नॉलेज, व्हाई विल आई डिलीट इट? ओके, मेनी ऑफ अस आर सेइंग life expectancy, some are saying life expectancy at birth, some are saying life expectancy at 1 year, some are saying standard of living. Okay, friends, most of us are right. This is life expectancy at birth. Why not life expectancy at 1 year? That is a part of physical quality of life index. See, it has 3 components: health, education, living standards. Suppose this time question comes through different choices, then health is life expectancy, education is knowledge, that is mainly through mean years of schooling, and living standards is by income. So 3 components of human development index. In PQLI, the 3 components are knowledge, infant mortality rate, and life expectancy at 1 year, right? So I'm happy all of you know this. Now 3 questions simultaneously. I can tell you one of them is going to strike in the upcoming exam. Tell me the 3 dates. I know dates are very difficult to remember, but it's not in my hands. You have to mark. So just write 6, 7, 8 in the chat box and write the dates. Let us see how many of you can get this correct. If anyone gets all the 3 correct, a personal chocolate gift for you from my side whenever we meet next. See, the moment I ask this question, chat box has gone dry. Okay, Dr. Rudra says 20th January 2020. 2020. Dr. Rudra, how it is possible? First case was on 27 January 2020 in India, in Kerala. So it's not possible. Okay, most of us have started giving the first answer correct. Dr. Shivani is correct. Dr. Soumava Mondal is correct. Sorry, I'm not able to pronounce your name correctly, Dr. Mondal. Then Dr. Sonam is correct. Dr. Dharamveer is correct. Okay, most of us are going right way. So COVID vaccination in India started on 16th January 2021. It was a health worker in Delhi, if I remember correctly, Mr. Manish, who took the dose of Covaxin first, just to prove to his family members and friends that it is an absolutely safe vaccine. So 16th January 2021, we started the COVID vaccination drive in the country. Many politicians, people said it will take 5 years, 10 years, 20 years to inoculate the country. But we have broken all the global records thanks to all of you doctors, health workers, ASHA workers, nursing staff. You have given your immense contribution to that. I'm proud of all of you. All of us, all India should, whole country should be proud of you. 100 crore milestone was achieved. Many of you have written it correctly. 21st October 2021. So within 9 months, we were able to achieve 100 crore vaccination milestone mark. And this year, on 17th of July 2022, we have crossed the 200 crore vaccination mark. Now we are going above 225, of course, right? So just go through these 3 dates once. If you are not writing in your notes, please take a screenshot, or otherwise this video will be there. You can watch it again, although there will be no need, because if you have gone through this once. Okay, most of you are marking the answers correct. Those of you who have marked all the 3 correct, just tell me personally or on chat box. Chocolate will be waiting whenever we meet next. No doubt at all, right? If none of you marked correct, then you will give me a chocolate when we meet next time. This is for sure in the party, your success party, right? Okay. Okay, let's move further. What is Mpox? Mpox क्या होता है? What is Mpox? Okay, Dr. Sonam has claimed first. Okay, Dr. Sonam, chocolate will be there waiting for you whenever we meet at your success party or otherwise. उससे पहले मिलेंगे तो पहले खिलाऊंगा chocolate आपको. Dr. Rahul also, okay, you participated. Thank you, Dr. Rahul, because it is doctors like you who have made this drive one of the biggest successes in the world. Everyone is looking at our vaccination drive in the country. Okay, what is Mpox? Dr. Vaibhav says money. Nahi, those, not everything is money, right? Okay, money bhi important hai, but itna nahi hai. Okay, everyone is saying monkeypox. Then why Mpox? Actually, you are right, doctors. Monkeypox. They are saying we don't want to create stigma for the disease. Therefore, we are changing the terminology. WHO has recommended just 3 days ago. Monkeypox should be called as Mpox. So let's hope there is no discrimination now by changing the name, right? Monkeypox, but I don't know kiski discrimination ki baat kar rahi hai. Khair, aage chalte hain. And finally, most important question of the session. How do you get your balance right? How will you get your balance right, friends? Tell me. Waiting for your answer. How will you get your balance right? Balance to life mein bahut zaruri hai. Even when you are walking, even when you are proposing to someone on one of the knees, balance zaruri hai na, gir nahi sakte us waqt. Okay, I'm getting answer cerebellum. दोस्तों वो तो है ही, but आपने cerebellum तो आपके दिल में है, लेकिन cerebellum के अलावा, okay, everyone is saying cerebellum. चलो, cerebellum is the global answer, but इसके साथ vestibular apparatus भी तो है. ENT वाले सर और मैम को नाराज थोड़ा करना है. So vestibular apparatus अपना भूल गए, वो inner ear semicircular canals, right? You have been sitting with me since last 1 hour 45 minutes. So this is your balance you are maintaining due to your cerebellum. Thank you so much, friends, for being a part of this session. What I can only say, please continue whichever source of preparation you have been using. Any institute, platform, notes, self classes, self-study, anything, whatever you are doing. But don't be just the same, be better. just make goals which are realistic, but try to be better, practice more, increase, enhance your accuracy. Accuracy होता है ना आपके स्क्रीनिंग टेस्ट में, याद है? बिल्कुल वही वाली accuracy, close to the true or actual value. Then you will get branch of your choice in the college of your choice, in the city of your choice. Then I will come there and take party from you in your college itself. Cerebellum Academy will always be with you till your examination and forever with you. Just keep on studying. That is the only thing from our side. Don't get distracted by anything, whatever is happening on social media. Social media का use थोड़ा कम कर दो. Try to focus more on these type of academic sessions. Right? तो मजाक करने तो हम भी आते रहेंगे Instagram live पे या उस पे, but academic sessions miss नहीं करना. Right? Thank you so much friends for being a part of this particular session. Get your balance right. Right? तो सारे की सारे 6 महारथी इकट्ठे आपको स्क्रीन पे नजर आ रहे हैं. आपका साथ नहीं छोड़ेंगे ये, राइट? आप नहीं भी चाहोगे तो भी आपको पढ़ाते रहेंगे, बिकॉज टीचिंग इज आवर पैशन. दिस इज व्हाट हैज ब्रॉट 6 of us and other 13 of us, all the 19 of us together. So just stay on course, keep on working hard, take blessings of your parents and teachers from all platforms. I can say on behalf of every teacher, our blessings are always with you. So just keep on working hard and go break the barrier, achieve success, and then definitely there will be a party. Thank you so much friends. Like the video, please subscribe to the Cerebellum YouTube channel. It is a new YouTube channel. We need a support from students. Subscribe to the channel and then we will keep on definitely engaging with you on a regular basis. So last session was Dr. Govind Rai Garg for FMG questions MIQ session. This MIQ session was for NEET PG, but definitely useful for FMG exams. And similarly, all educators will keep on coming and helping you revise the course before the exam. So friends, all the best. Thank you. Namaskar. Dhanyavad dost. Team Cerebellum, those who are moderating the session.